For this financial year, we will focus on a sustained vector control program, the adolescent health program, continuing work on the National Health Information System, strengthening oral health, procuring 16 additional ambulances, developing cancer care, acquisition of the linear accelerator machines. This administration will continue to build on the solid foundation that we have laid for the health sector to secure the future of this country and to make health a major player in the growth and development agenda of our country.
In line with that commitment, the Ministry of Health will begin the process of designing a 10-year development plan for the health sector this fiscal year. The ministry is also restructuring the public health services to deal with shifts in the population and the disease burden. These efforts will be supported by the continued upgrading of primary healthcare facilities.
We plan to undergo work at Granger Health Centre in Westmoreland, Comprehensive Health Centre in St. Andrew, Maxfield Park Health Centre, Christian Penn in St. Catherine, Runaway Bay in St. Anne will receive brand new clinics.
Improvement work will also be carried out on the Buff Bay Health Centre in Portland, while the Stony Hill Health Centre will be expanded. Design of a new health centre for Port Maria is to be completed, and the ministry is looking at options to fund a new health centre for Old Harbour in St. Catherine. At the same time, $460 million will be spent upgrading 12 secondary healthcare facilities.
Among these facilities, Mr. Speaker, will be the further expansion of the Linstead Hospital and the Princess Margaret Hospital accident and emergency area.
And progress is expected on plans to build a state-of-the-art child and adolescent hospital in Western Jamaica. Meanwhile, 16 new ambulances will be bought. Illnesses such as cancer, diabetes, and hypertension continue to burden the Jamaican health sector. So this year, the ministry will continue implementation of the National Strategic and Action Plan for the prevention of non-communicable diseases.
Efforts to reduce premature deaths from NCDs by 25% by 2025. The ministry is designing and developing a cancer care system of excellence to be located at the St. Joseph's Hospital.
This will result in the cost of full-course radiation treatment moving from $1.8 million to zero for the most vulnerable in society. The Health Ministry is also exploring the use of the human papilloma virus vaccine to significantly reduce the number of deaths and disabilities caused by cervical cancer in Jamaica. The move towards universal health coverage also continues. And as the fiscal year progresses, the Ministry of Health plans to advance its National Health Information System and e-health strategy using $30 million from the National Health Fund.
We will eventually link all our facilities so that we can have continuity of care and easily accessible patient records for more efficient and effective service.
The ministry's mission towards improved health outcomes for all Jamaicans this year is supported by increased financing.
We have doubled, Mr. Speaker, the pharmaceutical budget to $8 billion this financial year. We have significantly increased our health promotion and prevention budget from $20 million last year to $271 million this year. We have increased our equipment maintenance from $80 million last year to over $500 million this year.
The Ministry of Health, anticipating and responding to Jamaica's health needs, setting the pillars to make health a major player in the country's growth and development.